I just wanted to say, the time is now. It is now or never, guys. Cannabis has been legal in many countries, and if we don't do this now, we may lose the opportunity. It's time because patients need it, the science supports it, and I think this is the time for Philippines to actually shine and take over Asia with regards to medical cannabis, to be the leaders in this industry. Firstly, I'm going to talk about benefits, and thank you so much for the Philippines government for actually supporting this, especially Senator as well. So it's important that we look at supporting cannabis research as well as production. And as I mentioned, the Philippines can position itself as a leader with safeguarding public health and ensuring responsible use. We all know what's happening in Asia. We saw what's happening in Thailand. Thailand has opened up cannabis, but now it's time for Philippines to get it right. Yes, there were errors made all over the world, but we can use this benefits of medical benefits and get it right with Philippines. I believe Philippines can actually lead medical cannabis in Asia, and that is why it's important that we look at the benefits. It's for the patients. So I want to just talk a little bit about history, but not too much of time. I'm not sure if you are aware that cannabis has been used for centuries, actually before Christ, from 12,000 BC to 3000 BC. George Washington was a hemp farmer, as well as Lincoln and Adams were involved in hemp. But what was even more interesting is medical cannabis was actually used with a pharmaceutical company known as Eli Lilly in conjunction with Park Davies. And in the 1930s, we had over 3 million scripts of medical cannabis given to patients. And the benefits were seen. So I'm not going to talk too much about history, but I wanted to just put that into context. So why does medical cannabis work? So I'm trying to get to the next slide. Why does it work? And I'm going to talk some science, so please bear with me. I was told I speak in speed 4 times 100, so I'm going to try to slow down. So why am I so passionate about it, and why does medical cannabis work? Did you know that we are born with the endocannabinoid system? And without the system, we can actually die? Did you know that we produce our own cannabinoids in our body, and they're endogenous? And these endocannabinoids are really, really important to bring the body back into homeostasis. So there are actually 5 main endocannabinoids that we produce. The 2 main ones are anandamide and 2-AG. Ananda means bliss in Sanskrit, and that is how the body actually works. So I'm going to give you an example. I see there's lots of ladies out here. I'm sure there's lots of mothers out here. And normally when a baby is born, we tell that mother to breastfeed the baby. Do any of you mothers know why? You know. So I'm going to tell you. The highest amount of endocannabinoids, your anandamide, your 2-AG, is actually found in breast milk. So we produce this. So it is really, really important. So you will see the difference between a baby that's breastfed and one that is not. The one that is breastfed is much healthier. Okay, so that shows you how important these endocannabinoids are. So how do you produce these? When you're running or you're doing exercise, you feel euphoric, and that is when these endocannabinoids are actually produced in the body. However, if you have an illness, if you have cancer or arthritis and pain, you cannot exercise, which means you can actually not produce these endocannabinoids. And what we found in science thousands and thousands of years ago is that medical cannabis from the actual plant produces something similar to these endocannabinoids, and they are called phytocannabinoids. So phytocannabinoids are produced from the plant. You would have heard about CBD and THC, but there are many more of these cannabinoids in the body. So when you take the medicine, guys, you can see here, on you can see in the middle, there's an X-ray here. You have cannabinoid receptors in your body. So you have them all along the body. If you look at the blue, the cannabinoid 1 receptors are found in the brain and central nervous system. If you look at the pink, the cannabinoid 2 receptors are found in the peripheral organs and in the immune system. So what does this mean? When I take my cannabis from a plant, what happens is I want you to picture this as a key. And then I want you to picture all of these cannabinoid receptors there on the picture as the lock. So when you take the medicine, this key fits directly into these locks into the body, and it unlocks the potential for healing. So what that means is I'm now increasing my own endocannabinoids. So the last statement there, cannabis augments our body system. We need it. We need it to be healthy. We need it to help us for disease. We need it to heal. And most importantly, the endocannabinoid system in the human body is responsible for regulating many of your bodily functions, bringing the body back to homeostasis, which means balance. It's responsible for immune function, for sleep, for pain perception, appetite, bone development, memory, cardiovascular function, as well as the digestion. So if we go to the next slide, you can just press enter. Question people always ask me, is cannabis addictive? Yes, cannabis is addictive, but it is less addictive than the cup of coffee that is sitting on your table. So caffeine is addictive, it's sitting at a 9% addiction rate. Cannabis is sitting at a 7% addiction rate. So it is completely safe, guys. These are facts that I need you to remove the stigma so we have this information. Look at alcohol. The glass of wine that we drink, the beer that we drink, that is addictive because that is sitting at 20%. The cigarettes that we smoke, the tobacco, that is sitting at 30% the nicotine. So why are we demonizing something that is less addictive than the cup of coffee on your table? So what I am trying to say is the addiction cannot be equated with that of cocaine, heroin, opioids, or alcohol. The withdrawal is mild and short-lived. Even more interesting, did you know there is not one documented evidence of a pure cannabis overdose with the cannabis plant? Do you know why? So I'm going to give you a little bit more of science, if we can just go to the next slide. So in the brain, you have cannabinoid receptors, but in a specific area of the brain that controls your respiratory function, there are limited cannabinoid receptors. Remember the cannabinoid receptors I showed you just now. But what does this mean? This explains why there is no possibility of a fatal overdose with phytocannabinoids, nor has one been documented. So if we have to compare this now to opioids, your morphine, your fentanyl, and we have a huge opioid crisis all over the world, especially in the US, what is the difference? So in contrast, we have abundance of opioid receptors in the respiratory center of the brain. When a patient takes high doses of opioids, you would have seen things like methadone, morphine, fentanyl, oxycodone. They bind to these respiratory centers, opioid receptors in the respiratory center of the brain. And then what happens is the patient cannot breathe, the respiratory center is suppressed, and they have respiratory arrest and death. The beauty of medical cannabis is this cannot happen from phytocannabinoids because these receptors are not found in the respiratory center of the brain. So that is why it's completely safe. We can just go to the next slide. So further studies show, and this was taken from animal data, LD50 is something we use in medicine to look at 50% toxicity of a medicine. And if you look the LD50 of THC, you would have heard about THC, which is a psychoactive component of cannabis, but it's still fairly safe. If you take the LD50 of THC, of orally ingested THC needs to be over 1,000 milligrams per kilogram. So let me give you an example. If you are 70 kilograms, in order for you to have a lethal dose, you will need to have to take 70,000 milligrams of THC or 5,000 times the typical dose. It's impossible. Okay, so it's impossible for you to actually overdose. So why was this demonized? So I'm providing you guys with the truth and the facts. If we can go to the next slide, please. So, in medicine we have been using medical cannabis. There's been a lot of evidence-based medicine, and you'll see Canada has been using medical cannabis for over 15 years. The US, Israel has done so much of research. Australia's opened up, South Africa as well. And this is the conditions we've been using cannabis for. Chronic pain, one of the main issues, almost everybody's suffering with pain. And cannabis can be used safer in comparison to the opioids, which I've shown you. autoimmune disease such as multiple sclerosis, fibromyalgia, rheumatoid arthritis. I'm not sure if you're aware, the first ever cannabis medicine was called Sativex, and it was approved for multiple sclerosis. So it helped patients, and they saw this, and this medicine was approved. Other conditions for palliative care for patients with cancer, treating patients with cancer, which I'm going to talk about just now. Chemo-induced nausea and vomiting we use it for. Epilepsy, there has been clinical trials proven to show medical cannabis works for epilepsy, HIV wasting syndrome, ADHD, as well as autism. So if we can just go to the next slide. I have conducted clinical trials in South Africa. We entered these trials last year. I'm going to just give you a sneak peek. I was the principal investigator of the study. What we were looking for is to replace opioids with medical cannabis for chronic pain. So we wanted to see, can we reduce the opioids that a patient is taking or wean them off because it's so dangerous and addictive, and can we give them medical cannabis and will it help for the pain? If you look at the slides, we had a total of 302 patients. We had about the same amounts in male and female in the study, and this were the results. We had 93% reduction in opioids. So what that means is we are able to take 93% of patients off opioids, put them on medical cannabis, and help them for their pain. So patients' pain relief improved, patients' quality of life improved. We found also the anxiety improved, and even more importantly, the quality of sleep improved. So why did all of this work? We were treating pain, but my anxiety was better, my sleep was better. Why did it work? Besides the whole endocannabinoid story I told you about and the receptors, the reason is because cannabis works on a multi-level system. It's working on this entire endocannabinoid system, so it's bringing the body back to homeostasis. Pharmaceutical pills, they will work on a single receptor site, only treating symptoms. The game changer, guys, is cannabis will treat your symptoms as well as help you to heal your body. What other medicine can do that? That is what we're going to be talking about. You can just go to the next one. These are the majority of the patients, the diagnosis that we had. You can see most of the patient had arthritis. Then we had patients with back pain. We had patients with different types of cancer, fibromyalgia, MS, accidents, neuropathy, and spondylosis. So if you go to the next slide, I want to talk about cancer. And if you can see here, this is actually taken for the Philippine Institute for Development Studies. There are 25,000 cases of cancer in the Philippines every year. And if we look, there are 189 out of 100,000 Filipinos diagnosed with cancer. And roughly we have 9,000 Filipino women that die of breast cancer every year. So these numbers are really big. And every hour, there are 4 Filipinos who die from cancer. So there's been enough preclinical research on animal models, as well as some research of mine I will share just now, that shows cannabis can be used for pain. It can help these patients for pain. But even more exciting is what we found in animal models is CBD and THC, which are the phytocannabinoids from the plant, they trigger 3 things. One is apoptosis, they inhibit angiogenesis, and they are anti-proliferative. So what does this terminology mean? Apoptosis is when the cells turn themselves off and they allow digestion to shrink cancer cells and tumors. We call this cancer cell suicide. The other one, inhibiting angiogenesis, what that means is that cancer cells do not get fresh blood supply, which means they cannot grow. And the third thing is, cannabis is anti-proliferative, and these properties mean that cancer cells, they cannot send out genes to spread into other areas. In other words, it can reduce metastases. So my question to you is, if cannabis can do these things, it will be a game changer for healing and oncology. Why are we not giving it to the patients? While we are talking here in this press conference, 4 Filipinos have died. Okay? So I think it's an important fact that we look at healing and we look at the way we open our minds and open our hearts. So I want to talk about, if we can just go to the next slide, I conducted actually my third PhD on prostate cancer and medical cannabis, and we looked at an observational study. We had 90 patients. We looked at 3 cohorts. The first cohort of patients were patients on cannabis only. The second patient group was patients on cannabis and chemo only. And we compared this group to a control group. So we had a control, which were patients on chemotherapy only. We can just go to the next slide. I want to show you the results, guys. If you look at the graphs, just work with me a bit. We looked at the PET scan, so the PET scans to look at the tumor. So let's start with the cannabis-only group. If you look at the blue, it shows no change. Chemo and cannabis group, no change, and the control group. So they were very similar, but let's look at the red. The red block shows remission. If you look at the cannabis-only group, we had more patients in remission compared to the control group, which is the patients on chemo only. And if you look at the chemo and cannabis group, it performed really, really well. We had much more patients with the combined therapy with chemo and cannabis, where we had much more patients in remission compared to the little red in the control. If you look at the yellow, it shows you the reduced size of the tumor. So let's look at the chemo and cannabis group. Outperformed the control group completely, showing we had patients' tumor shrinking. And if you look at the cannabis-only group, very similar to the chemo control group. But let's look at the green. This is also really interesting. The green shows the metastases. And if you look at the chemo and cannabis group, we had less patients having cancer metastasized compared to the control group, which had much more patients that showed the metastases of the results. If we can just go to the next slide. So, sorry, if you just go on back. The other things that we show that I wanted to tell you about this study is we also show that patients had decreased pain, okay? So their pain was improved, their quality of life was improved, they were able to sleep. And what we found is they were able to get into remission quicker because they were happier. They weren't so anxious. And why? Because the endocannabinoids were produced in the brain. It starts giving you this feeling of euphoria. It starts giving you your bliss molecule, your anandamide. Remember, ananda means bliss. And that is why we had such good results with the patients, and that promoted healing. So guys, I would like to conclude. And I think it's important that patients have access to cannabis or medical cannabis. So we can just go to the next slide. And in conclusion, I would like all of us to stand together, and it's been a hectic time, and I know Honorable Senator Robin has been trying his best to push this bill and support it, and now we're doing it medical, we're doing it on evidence, we're doing it for the people. So honorable members of the legislature and other senators and the presidency, today we stand at crossroads where compassion and progress must guide our decisions. The issue of medical cannabis, it's not just about legislation. It is about humanity. It is about the countless Filipinos who suffer daily from chronic pain, debilitating illnesses, and conditions for which conventional treatments have failed. And we have seen this in medicine with all of these doctors. It is about families who have been torn apart by hopelessness, desperately searching for alternatives which they do not have access to, but they need to go to other countries, Thailand, America, Canada, South Africa. And what's happening? Philippines is also losing out with regards to economy, with regards to growth, with regards to showing the world what we can actually do. Now we have the opportunity to offer them a lifeline, a chance of relief, dignity, and a better quality of life. Medical cannabis is not a cure-all, but it is scientifically backed. I've only showed you a portion because I can stand here talking for days. I mean, I did it for 2 days, and we trained over 20 doctors that we have certified. They know I've been talking to them for 2 days. So we can see that. However, medical cannabis can offer scientific evidence, which we've seen. It's globally recognized option, and I have seen it transform the lives of patients in countries across the world. We are privileged today to also have one of the patients that I have treated, although he is my husband as well, we can also share his story. As public servants, we are called to act in the best interest of our people, to listen to their voices, and to empower them for choices for their health and well-being. Why are we removing the choice for them to choose safe and effective medicines? Let us not fear or misunderstand or allow any misunderstanding to deny hope to those who need it the most, the vulnerable. Let us instead send a message of compassion, of courage, and care, that we as government, we put our people first. By passing this bill, we are not just legalizing a medicine, we are affirming the right of every Filipino to live without unnecessary suffering. Let history remember this moment as a time when we choose to heal, to uplift, and to honor the resilience of our nation. I urge you all to vote and support this bill, not just as lawmakers or people, but as human beings who stand for the dignity and the welfare of every Filipino. Thank you and salamat.